uh, whatever the thyroid gland we have studied. So after the thyroid, there is a small endocrine gland, and that is the parathyroid. Whatever the name is, itself gives you the location and all details relating the that is a gland. So today we are going to deal briefly about that. This can be asked for the short notes. Thyroid can be asked for the long question. But parathyroid can be asked as a, that is the, you can remember about the, that is a short notes. So this is also a parathyroid gland is a one of the endocrine gland, important gland which is situated. When you see that this is a thyroid structure, and this thyroid structure on that posterior view, this is the posterior aspect of the thyroid. In this posterior aspect or the posterior view or the posterior border showing the thyroid, in this you are going to have the parathyroid gland. On the posterior border of the thyroid, there is a small gland which is situated on the posterior surface or lobes of the thyroid gland. Those we call it a parathyroid gland. Very small gland which is situated, and that is also the most important function or the metabolism of calcium. This parathormone is making its function in relation to the metabolism of the calcium. As we have already studied the hormones of thyroid, then thyroid this is also one of the plays an important role in the calcium metabolism. So that this also they are doing thyroid and parathyroid hormones opposite action. They belongs to the calcium metabolism, but they are making the opposite actions in relation. So that is a very important, you have to know about the thyroid and parathyroid. Okay, we are going to study the parathyroid. Very short topic, short notes is asked. So under these heads we are going to study the parathyroid. First I have already given you the introduction, location, size and shape, color, weight and position of the gland, where it is exactly, blood supply, lymphatic drainage, nerve supply and structure as we are going to get, and apply them. So these are the 10 heads we are going to cover the parathyroid gland. More detail about the structural and functional part is done in the physiology. So important part, which is the anatomy of the parathyroid, we are going to deal under these 10 headings. So when you see the parathyroid, in the introduction you have to tell this parathyroid is one of the small endocrine gland which is situated on the posterior part of the lobes of the thyroid, and or it may on the posterior border. And these are the small oval body-like structure which is seen on the posterior aspect, that is we are going to call it in a parathyroid. Then after the introduction, only you have to tell it is an important endocrine gland which is an important hormone secreted parathormone and plays an important role in the calcium metabolism. So this is the one which is you have to remember in the introduction of the parathyroid. Then location, when we go to the location of the parathyroid, I have told thyroid is having the right and left lobe, and it is having the anterior border and posterior border. So we are going to get posterior border of the thyroid gland. Exactly on the posterior border, we are going to get the situation of the parathyroid gland. They are 4 in number. They are not only one small gland, but small oval body-like, where they are situated on the posterior border. We can have this is a 2 both the side we are going to get, and 2 for the inferior. This is we call superior parathyroid gland, inferior parathyroid gland. So exact location where you can assess these superior and inferior parathyroid gland, that is very important. When you get the exactly middle of the lobe of the each one at the posterior border, that is situation of the parathyroid, that is a superior parathyroid. This develops from the fourth pharyngeal arch, development of thyroid you are going to study in embryology. It develops as from the fourth pharyngeal arch, so that it is also named as a parathyroid 4. Then inferior parathyroid is named as a third one, which is we are going to get the third, it develops third pharyngeal arch, so that we are going to have, that is the third parathyroid gland. Parathyroid third, parathyroid fourth. Either we can call as a superior parathyroid and inferior parathyroid. So they are 4 in number. We are going to group as a superiorly and inferiorly. So this is all about the first location of the parathyroid. It is very important where exactly. One more thing you can see, one superior thyroid artery is coming here for the thyroid blood supply. So same artery is supplying here also parathyroid. So exactly where we can see, I have told the middle of the posterior border of the thyroid, which is we are going to get the superior parathyroid is situated. Exactly where? Just above the or little near the anastomosis between the superior and inferior thyroid artery. Then inferior, this one which is there, where we have the inferior parathyroid artery. Below the inferior parathyroid artery, sometime we are going to get that is the location of the inferior parathyroid or the third parathyroid. This is the inferior thyroid artery. Below that, exactly. Here sometime you may get above also, but near the we are going to get the inferior thyroid artery. At where we are going to get the lower pole or the lower end of the lobe of the thyroid. That is the inferior parathyroid. So location is very important, because when there is a surgeon who is going to do the thyroidectomy, when there is a goiter, tumor is there, that time thyroidectomy is done, we may, by chance, we may remove the parathyroid also. So we are disturbing the totally the calcium metabolism, because both the glands which are doing the its action opposite in nature, both are lost. So one if we remove the thyroid, we are going to calcium metabolism is half is disturbed only. If with that we remove the parathyroid, that is causing the total calcium metabolism is disturbed, because there is no removal of calcium from the blood to the adding to the bone, or the whenever it is body requires blood calcium level is low, there is no addition of the removed from the bone to the blood. So this action is very important, so that when the surgeon do the thyroidectomy, we are going to preserve the parathyroid gland. It is very important when thyroidectomy we do surgically. That time it is very important to see the location of the superior and inferior parathyroid gland. Where you can trace, I have told exactly, if you know the location, then only you can identify that particular very small oval peanut size we are going to get, that is you have to find. So exactly where I have told superior parathyroid is also called as a parathyroid 4. It is develops from the fourth pharyngeal arch, so it is named as a parathyroid 4. Also we call a superior parathyroid. Where exactly it is situated? It is situated at the middle of the lobe of the posterior border. Posterior border, and this is the lobe of the thyroid, and exactly middle is the superior parathyroid is situated. Then inferior, you may have the location. One may be inferior parathyroid above or at the lower pole of the thyroid. Lower end of the lobe of the thyroid, they may be the situated, but where exactly? It is below the inferior thyroid artery. So this is the location very important during the thyroidectomy, because we are going to preserve the parathyroid gland. Then next, when you go to the size and shape, I have already told this is a very small oval body. Size is in oval in shape, and it is a peanut in size. Very small size, peanut in size we are going to get, and oval in shape we are going to get, and this will be measuring about 6 millimeter, 4 millimeter into 2 millimeters length, breadth and width. will be the 6 millimeters. We are not talking now centimeters. Thyroid is measurement we have studied as in centimeter. 5 centimeter into 2.5 into 2.5. But here I am talking about the parathyroid in millimeters. We are 6 millimeter into 4 millimeter into 2 millimeters. So that is exactly you have to remember about the size of the total parathyroid gland. Then I told peanut in shape, size we are going to peanut, and brown yellowish in color. Color will be the, I have told in the size after that color, which is, it is a yellowish brown in color. Very small gland, so that you have to differentiate from the thyroid tissue, that is posteriorly. So yellowish brown part which is found on the posterior border, near the upper end and lower end, that will be the exactly parathyroid gland. Next you have to go for the weight. Weight will be 50 milligrams. Weight of the parathyroid will be the 50 milligrams. How thyroid is 25 grams. We are going to get here is a 50 milligrams will be the weight of the parathyroid. Then position of the gland, I have told sometime, position of the superior parathyroid is nearly about the middle of the posterior border on the lobes of the thyroid. Then inferior, it may be variating. It may be situated above the inferior thyroid artery, but exactly lower pole, at the lower pole of the thyroid, below the inferior thyroid artery. That is exactly you have to remember about the location or the position of the parathyroid gland. Next, going to the other part where blood supply and all. So anatomy you have to deal, what are the structure posterior border, it is related. All those posterior border relations you have to remember relating the thyroid. As you have the medial, posterior lateral, all these will be on the thyroid, and parathyroid is on the posterior border. So all relations which are related structure which are onto the posterior border, they all will be the relation to the parathyroid. Then next you have to tell about the blood supply. See, has two major arteries, because it is one of the part which is situated in the posterior border of the thyroid only. Thyroid blood supply only it supplies. Whatever the superior thyroid, inferior thyroid blood supplying arteries are there, we are going to get, and those superior thyroid, inferior thyroid, they are supplying the blood supply to the parathyroid gland. So that is one which is you get. Venous drainage will be the superior, middle and inferior thyroid veins, and lymphatic drainage will be the deep cervical group of lymph nodes, as thyroid is draining pretracheal, paratracheal, prelaryngeal. So through that only the lymphatic drainage will be takes place as that of the thyroid. Okay. The nerve supply, we are going to have the middle cervical ganglion, superior and middle cervical ganglion. They are supplying the nerve supply to the parathyroid gland. So I have told what is the blood supply, what is the venous drainage, what is the lymphatic drainage, what is the nerve supply of the parathyroid. So this is all about the briefly one line you have to remember: artery, vein, nerve, and lymphatic drainage of the. As thyroid, you know, is it applicable same as to the parathyroid? Just that much only you can understand. That you have to correlate. Thyroid you study, then what are the things which are related, correlate with the parathyroid. Okay. So I have told blood supply will be the superior, inferior thyroid artery. Superior thyroid artery is a branch of external carotid. Inferior thyroid artery is a branch of thyrocervical trunk. It is also very important. Then venous drainage will be same. Superior, middle, inferior veins are there. Thyroid veins, drains. Nerve supply, superior, middle. We are going to get cervical ganglion. Lymphatics also we are going to get the deep cervical group of lymph nodes. That either through the prelaryngeal, laryngeal, or pretracheal. Those will be drained. So this is all about the total about the, you have come across the blood supply, venous drainage, lymphatic drainage, and nerve supply. Then going to the what is the structure of this parathyroid. When parathyroid you upper section you will see histologically under the microscope. You are going to get the types of cell which is we get as a principal or the chief cells or oxyphil cells, which are there present in the parathyroid, and they are secreting the only one hormone, that is the parathormone. Thyroid is secreting thyrocalcitonin. What it is doing, thyrocalcitonin secreted by the thyroid, what it does the removal of the, that is the blood calcium and stored on the bone. Parathormone, what it does, whenever body requires blood calcium comes down, that time stored calcium from the bone is removed and added to the blood. One is doing the parathormone, that is from the blood calcium it is storing to the bones and making the bone stronger and reducing. Ultimately it is removing means it will blood calcium level it reduces, but usually it is in the normally it not happens, it will maintain the balance. Okay, so that this parathormone, if there is we condition clinically we get as a two condition, hyperparathyroidism. Hyperparathyroidism means what? It will remove more and more calcium stored from the bone and it is adding to the blood, and blood calcium level it will be the increased, and that will be with the circulation it is going and reaching and filtered by the kidney, and there is a chance of formation of the kidney stone. One of the kidney stone formation, you have to assess the parathyroid hormone, because in condition where there is a hyperparathyroidism, that condition we are going to have the people may suffer with the kidney stone. You have to correlate why parathormone is removes the calcium stored from the bone or other tissue and it is adding to the blood. Blood calcium level will increase and that is circulated to the blood with the filtration to the kidney. Then kidney will be, there is a deposition of the calcium salts. We call as there is a formation of, we call as a kidney stone or renal lithiasis. Renal lithiasis means stone formation in the kidney. So this is the one hyperparathyroidism. Hypoparathyroidism, when it is causing, it is not removing the calcium from the blood. Suppose body requires calcium, blood calcium level not maintained. That time, this is parathyroid or parathormone has to remove the particular calcium and add to the blood. It is not doing so. Like some condition like tumors and all. Then it is not adding and maintaining the blood calcium level whenever it is required. Then it will cause the hypocalcemia, and that is we call it the tetany. Tetany is a condition. You should not confuse with the tetanus and tetany. Tetany is a hypocalcemia. That is due to the hypoparathyroidism. Okay. So that is the one which is you have to remember in the parathormone hormone action in relation or correlating with the actions of the that is a thyroid hormone thyrocalcitonin. So thyrocalcitonin and parathormone exactly opposite action. So this is the one which is, and one more thing which is instruction I have already told in the introduction. Third applied anatomy after the hyperparathyroidism, hypoparathyroidism. Third it will be the surgically removal of the thyroid. Surgeon should preserve the surgery should be done with the care taking, that is the preservation of the parathyroid gland. So that will be the very important. Otherwise, you are giving one more disease to the patient. Because already calcium metabolism after removing thyroid is going to be disturbed. We have to give the calcium supplements, thyroid hormone supplements. Again, we are with that, we are not preserved or not by chance, by mistake. There may be the removal of the parathyroid also sometime. So that is dangerous because we are giving the one more disease to the patient. So that is very important to the surgeon to preserve the parathyroid when the thyroidectomy, surgical removal of thyroid is done. That is we call it the thyroidectomy. So this is all about the, which is you have to know about the parathyroid, clinically very important. So many people I see that is due to the calcium deficiency, they have the different complaints or symptoms, tetanic. There are cramps in the all hands and all we are going to get. That is a condition where we can get that is a tetanic. So calcium level, blood calcium level is reduced. That is, that one which is normal blood calcium level, it is should be 10 milligram %. If it is reduced, we are hypocalcemia, increases hypercalcemia. So that is a normal 10 milligram % will be the blood calcium level. That you have to remember. So under these heads, you have to write 10 heads, 10 lines. Short notes will be the asked. 10 headings, 10 lines you will write for the short notes, 5 marks or 3 marks. It is more than sufficient because you are covering all the part. So these are the important that is relating the parathyroid. So it is a very small and important gland. I have already told, as you are females, when you practice, so many diseases, disorders relating, complaints relating, lady will come and ask for the investigation or complaints. You can better treat by the nutritional advice or by medication. If hypocalcemia is there, means you can give the calcium supplement. But side by side, you have to advise the nutritional food containing calcium. You can advise to eat the calcium which is containing like milk products and banana. All these wherever green leafy vegetables, also they have the all iron and calcium that can be, and fruits should be advised. So these all will be the nutritional advice when there is a patient is having the hypocalcemia. Or sometimes if you give excessive medication like calcium supplements, calcium nutritional things. So calcium goes on, patient goes on taking for the longer period due to the excessive calcium supplements or medication. Patient may land up, because of this may land up into a kidney stone. So you may have the different questions relating this when there is a hypocalcemia. We have to give the first food or nutritional supplements which are containing calcium, that you have to advise. With that you have to give the calcium supplements, whichever minimum required that you have to. But every lady after the 45 years, she requires the calcium supplements. So that this is very important. After the 45 years of age of the any woman complaints relating, you have to check the all calcium metabolism, calcium blood assessment and hormones of thyroid. You can, stone formation history is there, you can assess the, is it suffering from the hyperparathyroidism. So this is the one very important, you are clinically very important. When you sit in the practice in your clinic, you have to understand the mechanism and the hormone, how to check the when patient may be brought with the done all the investigation. Then my hormones are increased, decreased. I am suffering from hyperthyroidism, hypothyroidism, or a hyperparathyroidism or a hypoparathyroidism. You have to assess on the T3, T4, TSH and parathormone level. Very important, calcium metabolism which is involved, these two glands, thyroid and parathyroid, so that clinically very important. You better way, you can treat very important. I have told nutritional because when person is suffering from goiter and all, will be given iodized salt supplement. That may, some extent it may reduces. So that is when we see diagnose the goiter. Then when we others calcium deficiency like titania and all, you have to treat. Or brittle bones, bones become weaker because excessive removal of calcium and adding to the blood. So that time bones become very weak. So these are clinical application you should know. Then only you can treat very properly. So we cannot give the continuously or long-term calcium supplement. timely you have to assess the calcium blood level. Then you have to advise how many months or how many days you have to take the calcium supplement. But food advice, you have to give every patient nutritional advice for the calcium. Okay, so we have the banana, we have the other jaggeries and other green, dark green leafy vegetables where they all contain calcium. Even you have the milk and milk product. So people are not having the milk and milk product more, they suffer. Even non-vegetarians people with the B12 deficiency, they may land up into the hypocalcemia. So that should be understood in the clinical. So this is very important to understand these two glands, thyroid and parathyroid, and their hormone, their action, and what is the clinical anatomy of these two glands. Very important, endocrine gland. Here I have concluded the parathyroid. So we have covered the most important neck gland as the submandibular salivary gland, exocrine type of gland, and two endocrine glands which thyroid and parathyroid I have covered. So this is all about the parathyroid. Write down headings.